Welcome to the Dental Brief, the world's direct, right-to-the-point podcast produced to get you the information you need to learn and grow your practice. To learn more about our guests and find links to information discussed on our show, visit our website, dentalbrief.com. On to today's episode.
Hello, everyone. Welcome to another episode of the Dental Brief. I'm so excited about my guest today. Today we have Dr. Feinberg on. Dr. Feinberg, say hello.
Hi.
Yeah, Dr. Feinberg's here to help us with our dentistry knowledge, to help us get better, and skill sets to help build practices. Let's jump into your experience a little bit, Dr. Feinberg. Tell me about how long you've been a dentist, a little bit about where you've practiced, and actually, let's start. Tell me why you became a dentist. What made you want to become a dentist?
Well, I grew up in dentistry, and my father was a master and pioneer in full mouth reconstruction and full coverage restorative dentistry. So I had a huge head start because of that. And I started actually working in the office when I was 16 years old. And I went to dental school, got out of dental school very young in my life and started in practice. So I've been in practice for 43 years.
Wow, congratulations. That's a great amount of time. Tell me, why we have you on the show today. I want you to talk about some common practices that you see practice and facing. What's a problem that you see often that dentists face? And this could be a problem they know exists or one that they don't know exists. But what's an area of concern that you have for these practices?
Well, I think practices are having a lot of difficulties with crown and bridge work because they're having problems with recurrent decay and crowns falling out. And as a result, most of them would like to pull the teeth out and put implants in all over the place. So implants are being overused and used inappropriately. And I see more people having trouble today with crown and bridge than maybe 20 or 30 years ago. And it's very, very sad that a lot of the problems that they're having were actually solved in the 1930s.
Wow. So do you think that that there's an issue with having do you think it's an issue of skills, of education and execution? So do you think it's a skill set thing, or do you think that people are led more towards implants just based on profitability? Do you think they're kind of trying to help supplement incomes on their practice, or is it a mixture of both?
I think it might be a mixture of both. The real problem is that the current paradigm and skills that are being taught in the dental schools is wrong. And that's a very big statement to make. But I have over 100,000 pictures taken during the last 70 years of crown and bridge cases that were done with a certain, according to certain basic principles. And what's being taught violates those basic principles. And a lot of the new technology violates those basic principles. So it's very obvious to me why so many dentists are having trouble with crowns falling out and recurrent decay. This is not problems that I have. I almost never have these problems. And that's a very big statement to make. And that's because the paradigm that I have is completely different from what's being taught.
So I know that you have an educational website, the Onward program. We're going to talk about that a little bit more. And I'm sure some of those principles are listed on that site. That's free for dentists to go to, by the way. But tell me one of the principles, or tell me the most important principle that you're talking about that's not being followed.
Well, basic principles of crown and bridge are when you have to go back in the history of crown and bridge, especially full coverage dentistry, it was done differently in the beginning of crown and bridge when you go back to crown and bridge's roots. And they didn't have a lot of the problems that people are having today. When they first came in with porcelain to metal, they changed the paradigm because of the porcelain breaking on the restorations. And once that happened, that's when all the troubles started. But actually, it is possible to do good porcelain to metal restorations with the paradigm that came from dentistry's roots. And I explain all of that in the courses on my website. My website is more about basic principles and not so much about materials or having fancy equipment. You can do great dentistry without fancy equipment. So the most important thing are the basic principles. And a lot of the current technology is based on butt joint restorations. For example, all ceramic crowns are butt joint restorations that can never really be sealed at the micron level, which is the size of a bacterium. And that's why a lot of practitioners are having trouble with recurrent decay, because you can never seal those restorations. And what you think is sealed is not sealed at the micron level. And that's a very, very big problem. So when I do crown and bridge, my concept is on the idea of a mason jar cover, which is the best known thing ever devised for preserving food. So I almost never get decay under my crowns, which is a very, very big advantage. And I also get tremendous retention that most people don't get. Also, the current paradigm of how to take impressions of crown and bridge is wrong. They never get a complete impression of the entire root surface. With the current techniques, it's impossible to get down all the way with the rubber materials. It's impossible. So they never get enough grip on the root for retention, and they never seal the teeth properly against recurrent decay. So that's what the problems are. So a lot of people are figuring, well, why should I bother with crown and bridge when it's not very predictable in my hands? I'm going to pull the teeth out and put implants in. And that opens the door for a whole other set of problems. So I see in every magazine and in every course, you'll see where they're going to put an implant in is a space, and all the teeth around the space are falling apart. They either have big fillings or crowns in them, or they're going to need crowns. And that patient would be much better off with fixed bridge work, which does something for the entire area, and that's the end of all of the problems for the patient, whereas an implant only fills a hole or a space, and the problems continue all around the space. And so that's what I see going on, and that's sad. While I think implants are really a great restoration where they're indicated, they are really being overused and used inappropriately. A lot of teeth that they were extracting, I could save. I have techniques of saving teeth without posts and without buildups, teeth that are completely flush with the gingiva. And I don't think they're any different than any other teeth. And these are the teeth that are being extracted in order to place implants.
It's a lot of information. It's excellent information. What we'd like to do is make sure that our listeners have some things that they can do to improve themselves today in their practice today, not next week or a month. So if I said, hey, if somebody wanted to get better in this area of dentistry today, give me 1, 2, or 3 actionable steps that they could take today to make themselves better this week, next year.
Sure. Well, one thing is to recognize what's wrong with their current paradigm and to be open-minded to learning something new. A lot of dentists don't like having their paradigm stepped on, and they're not open to learning something new. The other thing is to visit the Onward program. The courses are all free, and each course is a half an hour to an hour, and learn how to do crown and bridge work correctly. And also recognizing that there's no quick fix that's any good in dentistry. I know, like today, the conversation's all about economics and not about excellence and longevity. But to visit dentistry is quick fix dentistry is not going to work. You can't skip steps and get a perfect result. So I teach all of that and how to do that. And the right attitude, like I'm going to learn how to do this, makes you better. That's how you become really good, is by recognizing that the desire to become better and that you're not going to let anything go by because you're not going to get away with it. Bacteria are microns, and one little error opens the door for troubles. And once you accept that, then you can become really good. And it's a skill like any other. And once you learn how, then it becomes easier and you could become really, really great. And the best feeling of all is when your patients come in and you did dentistry on that patient and you get to see them year after year after year for over 30 years and they didn't have to remake that dentistry. You know you did something great for that patient. And that's a better feeling in the world than anything else in dentistry. And one of the main reasons why we went into dentistry in the first place is to help people.
Sure. I love having a guest come on and talking about becoming a better dentist, improving the dentistry skills, techniques, and of course, patient outcome, right? That's ultimately we all have to be here. If we're not focused on patient outcome, we've got a big boulder to push uphill. It's a lot easier to push one downhill. So, Dr. Feinberg, I want to thank you very much for coming on the show and talking about this, but I also want to thank you for the program that you've put out there. It is free for dentists to go to. Again, it is theonwardprogram.com. I'm going to repeat that, theonwardprogram.com. Also, I noticed you have a Facebook page. That's facebook.com/The Onward Program. You can find links to his social media, to Dr. Feinberg's social media, and to his website on our website. Dr. Feinberg, I'll give you the last couple of words. What do you want to leave our audience with?
Well, I think dentistry is a great field. I think we have the opportunity to really help people. And I think in order to be a good dentist, you have to be good at a lot of different things. You can't be a one-trick pony. So while most people have become very adept at placing implants, that is not the answer to everything. And recognizing that it's not the answer to every restorative problem is the first step. So if you can do good crown and bridge, if you can do good implants, if you can make a good precision attachment case, you can pick and choose the best options for each patient. And that will make you an extraordinary dentist.
Great words of wisdom from Dr. Feinberg. Again, we thank you. Look forward to having you on the show sometime here in the near future as well. Again, thank you, Dr. Feinberg.
Thank you.
Awesome. Another episode in the books. Hopefully you got some great information out there. Take the advice, take action today, become a better dentist, and build your practice. We look forward to having you here for another episode. Take care.
You too. Thank you.
Bye.
Thank you for joining us on today's episode. Did you know you can weigh in on today's topic on Facebook? Search The Dental Brief on Facebook or visit our website, dentalbrief.com, and just follow the link. We look forward to having you join us again on another episode of The Dental Brief.